Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer, a dental hygienist from Bulgaria, Buffalo, New York, Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers, 8 Lumineers, 10 Lumineers, 6 Lumineers, 10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient. And now we're not treating teeth anymore. We're treating smiles. Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Okay, I'd say good morning, but it's good afternoon for you. I hope you've had a good day, and I hope this is the end of a perfect day for you. The best way to describe Lumineers, it's like driving a car and flying an airplane. You get up in the air and you steer, and you don't have all these restrictions and airspeeds and that. But getting up is a little more technical than driving a car. So flying an airplane is easier than driving a car, but it takes more skill. These are dental procedures that don't require anesthetic. I've been doing these for almost 25 years now. I've never given a patient a single drop of local anesthetic because I don't want to deprive myself of their sensory system. So this way, I know when I'm drilling on sensitive tooth structure. Now, before we get started, and I know we have one pilot in the audience, you know what it is to do pre-flight preparation. So we've done all our pre-flight preparation over here. I'll let you take a look at Lisa's table. And she set everything up. And it looks a little complicated, but if you put it into 5 or 6 groups, that's all that's there. And those pieces of porcelain, she's already pre-treated. She's pre-treated them with Cerinate Prime and with porcelain conditioner. Porcelain conditioner goes on first. Porcelain conditioner is citric acid. You need citric acid because it's an organic acid. It's an organic acid that activates your Cerinate Prime, the silane. You want to do that just before you place these because that's when you get your strongest bond. If you have a pre-hydrolyzed silane that's in a bottle, one step, put it on the teeth, it ages and it loses its potency like this, geometrically in a rather rapid rate. So you want to have a fresh bond. So once we start the bonding procedure, the surface preparation and bonding to that, things don't go better because I'm slow. Things go better because I get the job done and I get off the runway and I get them bonded and then I can start finishing. So that's what you want to remember there. And the Sapphire Light enables me to do that. One other thing that you have to look out for is your impression. When you take the impression, you want to take the impression and leave it in an extra minute, extra 30 seconds. Because so often you'll take it out at 30 seconds too soon, get distortion, everything looks fine, but then when you put the veneers in the mouth, they don't match too well. Take an extra 30 minutes for your first model. Be sure you're satisfied with those gingival margins because it's so disappointing when a case comes in, everything looks nice, but there's drag on the gingival margin because they never poured their first model. So pour the model and send it in. Visually, I'm going to be about this far from the patient. Visually. Physically, I'm going to be this far from the patient. So what 4-Power gives you is supernatural vision. It's better vision than any human being is ever born with and a better range of optics. Now here's a little bonus on this patient. We did a hugger bridge. Let's take a look at her teeth before and let's look at it today. And that just wraps around both teeth. You need enamel on both sides. And there it is back there. It needs a little contouring, especially on that molar. And we can do that very easily. She's polished all the teeth with porcelain polishing paste. We like to use the porcelain polishing paste because it's thixotropic, sticks on the teeth, gets rid of the plaque. What is plaque? Very simple term. It's grease. What is grease? It prevents you from getting a good adhesive bond. So you don't like to use pumice. You want to use a porcelain polishing paste, remove it, and then you'll have clean, dry surfaces to bond to. The first thing I'm going to do is put some paint-on dental dam on the lingual side of her teeth. Paint-on dental dam is what we use to separate the gingiva from the teeth when we're doing chairside whitening. And I put it any place that I don't want the ultra bond on the lingual side to bond to. I place the light, and then I close my eyes and push the button. And I expose it for 3 seconds. And then we test it. Okay, it's cured to the rubbery state. And I'll let you take a look at this now. And notice how we didn't let the resin go through that interproximal embrasure. Okay, and it's set to the rubbery stage. And we're about to begin now with surface preparation. So we're on the runway, we're firewalling it, and we're about to take off. So we want to get off the ground as fast as we can, off the runway. And I'm using Etch N Seal with aluminum oxalate in it. And the purpose of phosphoric acid and aluminum oxalate in Etch N Seal is to prevent opening the tubules and causing sensitivity. So when you're working with your patients that are anesthetized and you're doing operative dentistry and you open those tubules, the aluminum oxalate will seal them and prevent sensitivity from occurring. And that's how simple that is. Now I'm applying Tenure AB after I washed off that etching surface, and that was developed by a dentist by the name of Ray Bowen. You've probably heard of him, or maybe you haven't. Dr. Bowen was a very creative contributor to the art and science of dentistry. He developed the air rotor. He developed the composite. See how that etched surface is all nice and frosty? And he came up to me one time at Atlanta, Georgia, at an ADA meeting, American Dental Association meeting. He said, "Bob, I've got this fantastic dentin bonding system." And he said, "The only problem is it's got 9 steps." So we took out a license for it with the American Dental Association, put our chemists to work on it, and got it down to 2 bottles and 1 step. And you watch how I'm applying that. And we're going to do something for shade selection here. And I don't put all these in a patient's mouth because they don't look good when you put them in a patient's mouth. The interproximal embrasures are over contoured and filled with the porcelain. But the purpose of this little exercise is I like to let the patients have something to do with the selection of shade. And what I'm going to demonstrate to you is these are both the same shade luminaire. So why are they different? Well, the one on the left doesn't have any Ultrabond Tri-N paste on. The one on the right does. What happens to light when it goes through a medium? It keeps going forward until you exceed the critical angle. When it exceeds the critical angle, it bounces back. So what's happening here? The left tooth is bouncing back off the etched surface, so it looks like it's opaque white. But when you put the Ultrabond in, it doesn't. And we're going to put a different shade Tri-N paste here. Now look at this. These 2 luminaires are exactly the same shade. The Tri-N paste is exactly the same formula as the Ultrabond, except for one thing. it doesn't have any activator in it. So, first thing we're going to do is let the patient select the shade. Do you like the one on the right or the one on the left better? You don't know. You probably will like the one on the left better, the whiter one. Now, she's going to clean out the Ultrabond without the activator in it, the Ultrabond Tri-End paste, with something that I'm using too. It's called Tenure S. And what it does, I place this on all the surfaces after I've done this Tri-End for shade selection, because I want to get this applied to the teeth that I've prepared the surface as soon as possible. And if you put this on first and then do the shade, I'll tell you about an experience I had with my dental assistant. And I had put the Tenure S on and then I did the Tri-End. And fortunately, we got just the right shade. And she liked it. I went to take them off, and guess what? They wouldn't come off. They weren't exposed to the light or anything. So the Tenure S acts as a backup system. For example, if you don't get enough light to an area, and it's insurance. Now we're going to use the LumiGrip here. Left central. Lisa always calls out the name, just like she's my co-pilot. Right lateral. Okay. Right cuspid. This is called an LumiGrip. And then I use that to seat these. Left lateral. Okay. Such an easy way to carry it to the tooth and it doesn't fumble around. It's developed by a dentist here in Pasadena, California by the name of Omer Meeker. And he's an excellent practitioner, and he's a lot like Ray Bowen. He thinks about things a lot. It's always better to have too much than not enough here, because this is like if you take an impression and you get a void, you can have micro leakage and get a black spot under a veneer. And if the black spot was in the veneer, then the dentist should have never bonded it. Okay. Okay. And you want to just make sure these are all seated. Now these things fit like socks on a rooster compared to a gold crown with a tight margin when it's going to be cemented with zinc phosphate cement. Because your objective is to get what established? A stress-resistant, non-micro-leaking restoration. Give me the 2mm tip for 1 second. I gently place it on the teeth, and I don't like the system where you polymerize everything halfway. Close your eyes. Put it in the middle of the tooth. 1 second. I go to the next tooth. As I place it gently, I see excess ooze out from the tooth. When you see the excess ooze out, then you know you have enough resin there. If you have just the right amount, you never know if you have the right amount or not enough. They look alike. Close your eyes. And you want to come over here and reseat these. The 2mm tip fixes all these in place and lets you go back and clean up a little bit. Close your eyes. Now we'll take Tenure S in a cotton pellet. Just wipe it all around the surface, and all of the unpolymerized Ultrabond will be sort of wiped away. Now we take the 5mm tip, starting with the most distal tooth, and expose it for 5 seconds. Close your eyes. Now, if we were flying, we'd say we're airborne, but we're not wheels up yet. Close your eyes. Now I'm going to do 8 porcelain veneers, and they'll be completely bonded in about 50 seconds. If you happen to have an exceptionally large tooth, then you can do it for 3 seconds on the top and 3 seconds on the bottom, because a 9mm tip will cover just about everything perfectly. And with Bowen's bonding system, it's not light dependent. It works with all resin systems. We're now in place. We've bonded 8 porcelain veneers that you take at the lingual side. Let's take a look on the lingual side. Okay, see how we put that paint on dental dam all over there? So I'm going to take that out, and I'm using an instrument called Assure 349. Now all these instruments that I'm using are in the Clinician's Finishing Kit. And the paint on dental dam just pops right off. The Assure 349 is going to really be significant when I get to the labial side. Now we take the Assure 349, and you can scratch on this porcelain as hard as you want with the Assure 349, and you won't scratch the glaze. But if you were using your hygienist instrument, it'd be all scratched up. Now, I prefer not to scratch the porcelain, not that I can't put the glaze back, but it's extra work. Now we're going to take the football-shaped diamond here. What I'm doing right now is blending the tooth, the Ultrabond, and the porcelain all together. So it's one solid, homogeneous mass. Now we'll take a 12-fluted burr. What I'm doing with this 12-fluted burr and 4-power magnification, I'm getting into those interproximal embrasures and cleaning off the Ultrabond from the porcelain. The cleanup and the finishing is where everything starts coming to life. So we want to get these interproximal embrasures open, and all the Ultrabond that's between the porcelain and the tooth is good stuff. All the Ultrabond is outside the porcelain, and on the gingiva is bad stuff. Look how these interproximal embrasures opened up now with this next step, where I'm using this long, narrow diamond. And I'm staying off that labial surface. I contour this. But notice how I'm just gingerly going around the gingiva, and wherever I've got that shoulder, I'm very gently, with high-speed water spray, removing that porcelain. Now, you've been taught never to touch those when your technician is done with them. Let's take a look at these gingival margins to see what we got. We've got rid of the shoulder, and now as I go over this and blend it up, got about a 45-degree angle. I'll take a little bit more off that right central there. And I don't take it all off today. That means that I get most of it off today, but I have my patient back in a week. And usually we sit and talk for 10 or 15 minutes about all the fun experiences they had when people got to look at their teeth and how nice their smile was. Now remember, you've only got one smile, but you got a whole bunch of teeth. And we dentists have been taught to treat teeth, and I only treat smiles. One smile's 8 teeth, maybe 10 teeth. And when we do the tops and the bottoms together, then they're like 20 teeth. Now I'm opening the embrasures from the lingual side, just like I did from the labial. And the better I do this, the easier the opening of the interproximal embrasure will be, the contacts. I go back to my American football shaped diamond, and I removed what I missed before. I used to try to get everything on the placement appointment, and no matter how I tried, I always found that I missed something on the next visit. Before we open the contacts, we want to check the occlusion. Open it wide. Close. Look how nice these look. Open it wide. See this mark right here on that central? Right there. Now that's on natural tooth structure, but look how it comes up to the porcelain. So you want to make sure you don't have marks on your porcelain. And this is on natural tooth structure. Let's take a look at her lowers. Close. Look at that sucker right there. See these two right here? Lateral right at this spot. That's just aching to chip off those edges. So I'm going to take at a 45-degree angle parallel to the tooth, 60-degree angle parallel to the tooth. I'm not going to shorten the teeth. Now close. Grind your teeth around, forward and back, open. It's a little better. There's a spot over here on this cuspid that I'm going to take a little off right here. See that right here? But these blend in very nicely. The margins between the enamel and the porcelain and the Ultrabond are indistinguishable. Now I want to do some more emergence profile contouring on this, and I'm just going to take anything that doesn't look like the right emergence profile, and I go at about an 80-degree parallel to the tooth to get the emergence profile that I want. And when she comes back next week, I'll do some more of this. So now the moment is here. We've taken care of the occlusion. Here we go. That was pretty easy. Now if you get in there and it isn't sawing, use a fair amount of controlled force. So let's say that you get halfway through and it's real hard, you want to saw some more. Don't saw, rock. See this? So you get halfway through and you rock. Okay, so I start rocking again because it's hard to saw through, and there is a little extra Ultrabond in there. Give me an Explorer and I'll take some of that out. So far I haven't failed to open a contact, have I? That's unusual. Now we'll take a Seri sander. Seri sander is like the Seri saw, but it's diamond impregnated. And now we've transformed this patient's appearance in about an hour. I'm going to finish it off a later visit. Got her contacts opened. So good luck to all of you, and here's our patient if you want to take a last look at her with a big smile.
The main thing I didn't like about my smile was I had buck teeth. Never really got teased about it or anything but it was something that bothered me a lot. To put them on, there was no shots or drilling of any sort. It was great. Just laughed the whole way through. Well, kind of laughed, the whole way through because I had those things in my mouth, prying it open. But yeah, no, it was great. It was probably one of the better experiences I've had, and being in a dentist chair. To have Lumineers done with the grinding and all that, no, or shots, I would have definitely not had that done. Yeah, I show my teeth a lot more when I smile, Before I did too, but then I'd sort of cover my mouth, as I smiled. But no, I don't do that anymore.